and welcome. My name is Calliope, and we are going to be performing a very special examination today. We're only going to need 2 tools. My hands and my stethoscope here. We are going to be performing an examination using 2 of the important manual diagnostic techniques, palpation and auscultation. So, if you don't mind, I'd love to start with some palpation around your face. Okay, excellent. So, let's just take a little peek here. Let me know if at any point you feel any pain. There's a spot that's tender at all. You're the last patient of the day. It's getting pretty late out there. Do you have any plans for after this examination? Well, I hope by the time you leave the office, you can at least get some relaxation in. I'm just very gently palpating here, not even really putting much pressure. I'm just letting my fingertips pick up information. There. Feeling for any textural differences or seeing if there are any painful spots here. Just getting the sort of topography of the skin. There, just like that. These little bits of feeling, and then we can put a little bit more pressure behind that as well, and get a little bit more information that way. Good. Along the nose here, down the midline of the face, around the orbit, one eye, around the nares here, and the mouth, the ears, and we'll start looking a little bit into the head, the scalp area. Good. Just gonna get a little bit closer here. There we are. Good. Just very gently, using my fingertips here. And then underneath the jaw here, underneath the mandible. Just like that. Just get in along the neck here. One side. Right here. If I could just have you turn your head, we can just isolate the sternocleidomastoid. Good. Okay, and back to neutral. Just this side right here. Good, and if you could just turn the head the other way. Good. And back to neutral. Let's bring out our auscultation device. Auscultation meaning that we are listening. So let's start by auscultating the temporal arteries right at the temple area. So I'm just going to place my stethoscope right here. You just hold still. That's all you have to do. Just hold still. And the other side here. Do you mind just closing your eyes so that I can just very gently put the diaphragm of the stethoscope here on the eye? Okay. I'm not going to put any pressure behind it at all. It's just going to be very gentle. Just very gentle. Good. Okay, the other one. It's very gentle. Good. Okay, excellent. Now, I'm just going to auscultate the carotid artery. So, we already did just a touch of palpation here. Nothing with any pressure behind it. And I'm going to listen right here. What I'm going to have you do is so that I can isolate the sound of the blood flow. I'm going to have you take a deep breath in just hold that for a moment. Good, and let it out. Okay. Deep breath in. Just hold. And exhale. Good. We'll just do that on the other side. Deep breath in. Hold. And exhale. Deep breath in. Hold. And exhale. Very good. We'll take this out for just a little bit. And then I'm just going to come back to the carotid arteries and palpate one at a time here. You don't have to change your breath at all. I just want to make sure before I put any pressure here that there aren't any bruits, which are audible heart murmurs when listening to that blood flow. We don't want to cause any issues there. So, if there aren't any bruits, it's safe for me to use the gentle pressure to palpate this pulse right in here. Good. Good. Let's go ahead and move down a bit. So, normally we'd go into the chest, but let's go ahead and just take a little detour. We're going to look at your arms. So we start with the junction between the neck and the shoulder. We can get into the supraclavicular fossa right in here, for example. Just that depression. That's what fossa means, is depression. Like the cubital fossa is the crook of your elbow. And then we come into the shoulder joint. And this is called the glenohumeral joint. Feel around our little rotator cuff muscles here. And then down, we have the deltoid here on the lateral edge. Get biceps, triceps. And if we go the back of the arm here, one of my more favorite muscles in the arm, because it has kind of a long name, is called the anconeus. And it's a generally, I don't want to say easily forgettable, but it's not a muscle that one often thinks of, like biceps and triceps are in common lexicon quite a bit. Even deltoid is. And I would argue even the flexors and extensors of the forearm, that these are a little more known than the anconeuses. I like the more lesser known parts. We have the tendons on each side of the elbow here. Coming down, we have the radius and the ulna bones. And then we have our extensors and flexors. Our extensors allow us to do this. They're on the back of the arm. Our flexors allow us to do this on the inside of the arm, the anterior arm. Then we have our carpals, which are the wrist bones. We have our metacarpals, which are the hand bones. And the phalanges would be your finger bones, and the anatomical term for your thumb is the pollex. Pollex, P-O-L-L-U-X. Pollex. Not to be confused with bollocks, of course. Very similar, but vastly different meanings. Here we have quite a few different muscles. For example, we have the thenar and hypothenar muscles. Here's some of the big ones. We're just going to feel each finger here. Feel the joints. And in the pollex here. Down. So it's interesting about the thumb. We look at the fingers, right? We have one joint, two joints, right? We have our distal joint and the proximal joint. The thumb only has one. And it's this one right here. So what is this? What is that? That is part of your metacarpals. It's not actually a joint like the rest of the phalanges. There. Now, I'm going to just feel the pulses. So you have the radial on the radius side of the arm, the ulnar on the ulnar side, and the brachial right in that cubital fossa we talked about. So I'm going to bilaterally palpate the radial and the ulnar pulses. Two birds, one stone. There. The ulnar is a little shy. Radial pulse is readily available for those that want to feel that, but the ulnar takes just a touch of coaxing, rather. Not coaking. And brachial here, I also find to be a touch shy. But once you can figure out that particular location, that it jumps out at you. Now popliteal's a whole different enchilada. Now the other arm. We have a little juncture, so on the posterior side, on the dorsum, we have the upper edge of the trapezius muscle, aptly named for its trapezoidal shape. That's what I like about anatomical terms, generally in Latin, is sometimes they are just very obvious. They don't try to make it sound like anything special. For example, your muscle right in here, the sphenoid bone, is the temporalis. And in Latin, that would be the time muscle. Whereas, for example, the biceps muscle means 2 heads, biceps. Triceps meaning 3 heads, referring to muscle attachments. Coming down the humerus here. Good. And our elbow here. A lot of the muscle names are pretty intuitive. They tell you exactly what they are, what they do, or where they are. For example, you might get a muscle name that has longus in it, which means long, and brevis, meaning short, as in the root of the word brevity. And then you have your extensor and flexor muscles. Those tell you what they do. So if something is an extensor, that's obviously on the back of the arm. If it's a flexor, it's on the inside. The muscles that have different positions, like the suprahyoid muscles, are above, superior to the hyoid bone. The infrahyoid muscles are below the hyoid bone. And while we've already looked at the neck, we are down here at the hands. This probably feels a little bit more like a massage. And then we'll come to the chest next. Good. So here we have our clavicles, and we can get all the way from the sternum here, have our clavicle come across, attach it to the shoulder by the acromioclavicular joint here. Right in here on each side. And then if we come back in the middle, the sternum has 3 different bones in it. So the very top, if you feel this little notch right here, this little U-shaped notch, that is called the manubrium. And then you have the sternum, which is your main plate. And then one of my particular favorite bones, the xiphoid process, is that little triangular bone right in the middle here of the torso. And then we have all of our ribs here and the intercostal muscles, or the muscles in between each rib. Very important, but it can be a real pain sometimes if you've ever strained an intercostal muscle. Not fun. Not fun. So here we have pectoralis major is going to be our big guy in here. pectoralis minors right over here, lateral edges here. And then I'm going to be feeling for heaves and thrills with the heart. So I'll use the heel of my hand for heaves. We'll just feel if there's any quite literal heaving in the chest. And then the flats of my fingers, I can feel for thrills, which are palpable heart murmurs. Just feel across the heart here. Now the apex beat, this is going to be your mid-clavicular line, and then you count your intercostal spaces down from the sternum here, and you meet the two together. That's where you should find your apex beat of the heart. So if we go 1, 2, 5, and meet right in that area. So we're just going to just feel this. And that's where your apex beat should be. Let's bring out the stethoscope for a bit. And we'll start with the valves of the heart. So we're going to start with the aortic valve. And then move over to the pulmonary valve, the pulmonic. Good. And down and back over to the tricuspid. And then finally over to the mitral valve. So we used the diaphragm of the stethoscope, but this is used to hear higher pitch sounds. If we turn it to the bell, this is used for lower pitch sounds. So we'll try this one as well. So, aortic valve, pulmonary, the tricuspid, and the mitral. Good. Now, we can listen to your lungs all the way from the apex and down and the sides. So we'll start way up top here. And I'm just going to have you take a deep breath in here and out. Good. And deep breath in and out. Good. Just moving down so we can compare one side to the other. Deep breath in and out. And deep breath in. Wonderful. Deep breath in and out. 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 I'm going to listen to the sides of your lungs as well. So, a cool little thing about the lungs, if you didn't know, one side of the lungs has 3 lobes. One of them has 2 lobes. Can you guess which is which? The left side has 2 lobes because it needs to make room for the heart. There's actually a little built-in spot there for the heart to sit in, whereas the right side does not need that extra room for the heart. So we can listen to the right side and we can get that 3rd lobe, but just for an equal auscultation, I'll do the other side as well. You could lift up your arm here. Okay. Deep breath in and out. Deep breath in. Okay. And the other side. Deep breath in and out. Deep breath in and out. Good. Now, as for the posterior chest wall, I'm just going to have you turn around for me so that I can listen to the back of your lungs. Okay. All right. So, have you take a deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Deep breath in and out. Deep breath in. Go. You can go ahead and turn back around. Now, before we put our stethoscope down again, I am going to auscultate your abdomen. And the reason we do that first is because if I go in with palpation, that's going to change the sounds that your organs make. So I want to listen to them before we go in and do any manipulation here. Don't need to do any special breathing here. We're just going to take a little listen. Good. Put this down. And I just want to do a little palpation here. So we're looking for tender spots, and also we're looking if there is any change in size in the organs. For example, is the spleen bigger than normal? The liver, the kidneys? do let me know. I trust that you would tell me, but I'm just reiterating. Do let me know if there are any tender spots, any pain here. I'm going to use both my hands here. This is a deeper palpation, so I'm going to have you take a deep breath in and out. I don't want to punch the air out of you. That would be quite rude of me. Deep breath in and out. Good. And last one. Deep breath in and out. Okay. So, why don't we take a look at your legs here? We'll start with the hip joint. And just do a little bit of palpation here. Good. And move down to the hip. So here underneath this we have the all-powerful femur. It's a big, dense, strong bone. Then we have your patella. So patella is another bone word I like because it means plate, as in like, yeah, it could refer to a dinner plate. So here, I don't know if you ever have any issues with the knee joint here, but some people also have some issues with the ligaments on each side of the knee. Let me know if these are tender. Ligaments here are so important, and if they go out, it's not a fun time. Not a fun time at all. I recently had the very fun opportunity to find out my family has Ehlers-Danlos syndrome because my ligaments in my knees are shot. So that was awesome. We went from generations of us talking about how bad our joints are and how weird we respond to different medications and how we all have these strange, kind of allergic reactions and whatnot. It was kind of a sitcom moment, really. And down along the shin here, so something I think is not cool at all is that we have the tibia and the fibula. Slant rhymes, not true rhymes. I mean tibula and fibula, tibia and fibia. We had an opportunity, we wasted it. We have our big old calf muscle in here and down into the ankle. So, as a mirror to the hands, our ankles are the tarsals. The bones in the foot are the metatarsals. And then you have the phalanges on the foot, which are the toes. Good. And then so we have the dorsalis pedis pulse right here on the foot. You can just feel that. And then we also have the post-tib pulse right above. And then behind the knee is the popliteal. I'm going to have you just bend your knee. I'm going to use both hands to get in there. This one can be very tricky. Some people it's not palpable either. Not unless you really dig in there. we're going to leave the femoral pulse alone there. We'll just go to the other side. Hip joint. And coming down along the thigh. Lots of different muscles here, and we also have the IT band, the iliotibial band. Of our hamstrings, our quadriceps. Now for the quadriceps. If biceps means 2 head, triceps means 3 heads, then what would quadriceps mean? 4 head, yeah. As opposed to the 5 head. And into the knee. Nice little patella here. Is it tender at all around here? That's good. Good. And down the shin. So the shin is a good place to check out because there are certain skin abnormalities that can be found in the shin. For example, the back of the elbows is another good spot to look because you can find signs of plaques, for example, plaque psoriasis. Come all the way down to the ankle. We have the Achilles tendon back here. And in between all these little tendons here for the toes. They can extend and flex here. Good. And the bottom of the foot. There we are. Okay. Last little bit. Just going to take our stethoscope. And I'm going to just auscultate our pulse points. We already got the carotid and the temporal. So we'll start here. And we'll get dorsalis pedis. Post-tib. Okay. And on the other side. Post-tib. And we'll skip popliteal. That one's a bit of a bear. Okay. If I could see your arms, we'll do brachial here. Good. And the radial pulse. Ulnar pulse. Other side. Brachial. Move it over a bit. There we go. Radial. Ulnar. There we go. All right. Excellent. So that will conclude our palpation and auscultation examination. Thank you so much for allowing me to, well, kind of fill you up, I suppose, and also listen to you. I really appreciate it. Thank you, and have a whale of a day, and a good rest of your night. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons, without whom I would not be able to make these videos. Is whom correct there? I don't think it is, but it sounds fancy. Like perchance. If you would like to check out my Patreon, I have early access to videos on there, as well as a boatload of exclusive content. Thank you so much. I hope you have a whale of a day and a good rest of your day.